Rubens Kignel, psychotherapist and teacher, and I'm talking from Athens during the European Congress of Body Psychotherapy. And at the moment, I am here with my colleague and friend of many years, Bettina Schroeter from Germany, Berlin, where she lives, and we are going to continuing talking about psychotherapy, and I'm sure Bettina will bring a theme that is quite important for us at the moment in the society, in the private life, etc. Isn't it, Bettina?
Yes, that's true. So I'm in the ERVP since its beginning. I'm a director of a training school since the early 90s. My background is coming from biodynamic psychology.
Biodynamic,
yeah, and biosynthesis. I'm got also through my own process in body psychotherapy, through my own development and my own experiences in the processes, I got very interested in questions of transpersonal psychology. So in kind of existential questions about birth and death, existential crisis. So I also studied a little about transpersonal psychology. But some of the techniques were a little too airy-fairy for me, so I always stick to the somatic interventions because these keep you on the ground. So in my training program, in the training method we offer, I call it transformative body psychotherapy. We integrate the neo-Reichian techniques and methods, and I include in the curriculum also topics like existential matters, getting older, facing mortality, death, heavy sicknesses, like existential crisis you enter. As I was getting older myself, I saw the solution for accompanying adult clients is not only the regression. That's an important part, to go back to the roots of where conflict started, of fixation, are holding us back in an old pattern of dealing with life. But you also have to help, and I think there are good options with the body psychotherapeutic techniques to help adult maturity. And I think it needs active support too. It doesn't happen automatically when you have regressed enough.
I found, for example, with our patients, our daily life patients, the ones we see in our practice, not only in the training situations, because I think sometimes it's a bit different.
Yeah,
yes?
Sure.
So, for example, to get into existential level with patients in daily life, is something that demands, a work. I feel like a kind of work of cleaning. Cleaning by, it's not that it's dirty, but cleaning means that taking away a bit of the daily life problems so that you can fall into your existence, a kind of existence, because existence is a subject that is already quite complex.
Yeah, it depends totally how you define it.
Yes.
Sometimes it's good to take people away from the daily affairs and bring them to deeper layers of beingness in themselves.
Yes.
I agree. Sometimes what I have in mind is other situations, like a client is 60-year-old, he has to undertake surgery because of prostata problems. So existential matters come into his life. Or I had one lady, she was a teacher.
Yes.
Her husband had a heavy cancer process.
Yeah.
He didn't want to go to therapy, but in a process of 2 or 3 years, I accompanied her to face it, the option that this would be a very difficult process. that she had to face. She would maybe lose him, how to be with him, how to regulate herself.
Yes.
And finally, he passed away, and for her to be able to be with it, and then also in the time after, to digest the loss. After 30 years of marriage, to learn again to live alone.
Yeah.
So things like that. Then it's not appropriate so much to go to early childhood layers, but to give support, and also quite body-orientated support.
Yes. Yes.
You
Well,
know?
I think you're bringing something quite important that it comes to the clinic many times, is that when you work indirectly with someone, so you bring the example of the husband has a cancer and you work with the wife, and then the wife will bring what she's doing with you, as she will bring back home, and it will deal with the situation.
And it was very touching to hear the stories, how it affected him. Because in the beginning she was so sad that he couldn't talk about anything, about his feeling. He was just blocking it. And she took away the pressure. She didn't expect it anymore in a way. It was helpful for her to talk with me, and go through her emotions around it. So she could just quietly and lovely be with him. And then at the end, also as a death process took over in him, he could really open up his heart, and they had a very good goodbye. It was very moving for me to hear it.
Yes, it's quite deep. That sometimes I also worked, for example, sometimes the parents they want to send a child to do therapy, and sometimes I feel that it's better to work with the parents, and the parents will take care of the child, and not the therapy with the take care of this way directly, so we can do always indirect work.
And this guides me to my other topic, where I'm also a little specialized or engaged in professional politics, as you know, recently. That is questions around gender and the different way as women and men to be in the world, to deal, how we have learned to deal about emotions, and then also conflict which can arise in couples around this. As I'm myself a woman, sure enough, and many more women come to therapy anyway, and then especially to a woman. Many female clients look for a female therapist. So I have learned a lot, or reactivated something of my feminist thinking which I had when I was a young student in the 70s. And so it was very interesting over all these years to watch the processes of women and to see. Even we have in the West women's liberation, and some people say everything is done, women are almost equal. To watch how deep in the psychic and physical structures these old role models or insecurities in female identity is implanted. And how, if I would bring down all the women I have worked with in all the 35 years I have been working as a body psychotherapist, if I would bring it down to one nominator, I would say they always need support to say, I am, I can, I will, I want, I'm capable. Like an encouragement in the individual me. It is so like
reinforcing the identity.
The identity and the self-esteem. When we study from socio-cultural history the old gender roles, and then women, they had to be just a wife or just a housewife. It has weakened the identity, the self-esteem.
Sure.
And what's also interesting to watch some gaps. So in a country like Germany, you have many modern women, and Up here, there's all the naturalness of a modern self-identity, but then deeper are layers of the insecurity
Sure.
and the old role
Insecurity
models.
about the identity, no?
Yes,
it's
and
not
about
general insecurity.
yes,
it's about
yes,
the identity.
yeah, about the identity.
Yeah.
For example, interesting phenomenon. Think of a group of clients between 40 and 60, and by their job or some position, being a doctor, if say a woman gets into a guiding position, you say this, or you know,
yeah, yes.
how they struggle with a role model.
How they struggle with the wrong model.
Because they have a hard time, you know, they want to be the mother or the good friend of everybody. And how they struggle to set boundaries, to demand something of their employees, which I think is much more easy for a man, you know, as if they have a guilt to do this, to step out of this old nurturing, caretaking role.
Usually I say that the capacity to say no.
Yes.
Capacity to say no. Because when you say no, you say yes to yourself. You come back to yourself.
Yes.
You know? And I had this experience, I remember very much in Japan, because the Japanese women, at that time, like say 30 years ago, you know, my experience is that they had lots of difficulties to say no. And for a Japanese woman, just to say no, no, basta, something like that, she has to find several ways, different and indirect ways, and they became very clever. So they could say no, but they could never say no directly.
So, and there I think the Asian culture comes on top, into place, the gender role and the culture.
I don't know about Asian, but I'm talking about Japan because Asian is very big. Asia is very big, and maybe it's different in other countries. But that was the experience there, you know. And I'm sure the women in Japan changed a lot from 30 years to now. Not because I was there, but because the whole society became more conscious about that. You know, I don't think it's enough yet, but but even because with changement of women, this implies changement for men, you know.
Yes, exactly.
Because it's a system. We live in a system.
Yes.
It's like you say, you work with the wife that finally gets into the husband, you know. So you work with the women that finally gets with the men, or you work with the men that finally gets to the women. So we all the genres, all the genres, we find problems in both sides. You know? We can only say we can also say that it's not only two now. There are some genders now.
Yes, and it's like a transfer time, because you can also see that the changes are really on the surface. But at deeper levels, they are the old imprints of centuries. You know, and the same way in the male roles, I can see the problem of the masculine side. So many men are gotten very insecure. You know, and then it's only a certain selection of men come into therapy anyway. You know, because a successful man, as society is still male dominated. The successful man doesn't need to go to therapy. They come only when something goes really wrong in their life. They have a heart attack or burnout, or their wife leaves them. Or the men who suffer from the male ideal. If they don't succeed, if they're more a little
success,
passive feminine type, you know, then they suffer because of this. They don't feel male enough. So the process of change is still very gradual and slow.
This thing of it's the same problem of identity. You know, identity of a woman, identity of a man. You know, I remember, for example, in the development, it's very interesting because when the children become, let's say, more aware of the differences, you know. It's very common that the boys, they get together with the boys, and the girls, they get together with the girls. And I understand that as reinforcement of identity. You know,
Mhm.
if I am with the people that are like me, I reinforce my identity because the difference make me afraid. You know, so it happens with boys and girls until one moment when the identity is more secure or more clear. You know, so they might get interested in each other
Yeah.
without so much fear from the differences. No,
Yeah.
so
And I think I'm very much for the how you say, acknowledge the beauty of the difference and to encourage the difference
yes, yes.
and still give everybody a lot of freedom, you know, to open up the conventional roles a bit.
Yeah, yeah.
So some people express so much fear, then we are all equal, or then everything is neutralized. I'm not worried there. We will be still enough because I think there is always a two dimension. The biology does something with you. You know, that I have a female pelvis, that I have female genitals, a female body, that I have the potential to be mother, that I have menstruation cycle, that influences my psychological feeling, my feeling of the body, and together with the social construction of gender in the time where I live, in the culture where I live.
Yes.
You know?
Yes.
And for the man, the same. So what I find important, that a psychotherapist or body psychotherapist has an awareness about it. What I experience, the practical implications in working with clients, not only trainees like you emphasize, it's often when I say to the client, I think this is a very typical female problem. There is a kind of relief, you know? It's not only your individual problem, your individual load, or your individual difficulty. To embed it in the bigger picture can make a relief and encouragement for the client.
Sure. So because there is a way I see you, there is a way you see yourself. No, and then sometimes there is a conflict in between both of them. Right? It's good. I think this is a very important subject to dialogue, to talk about, and that will rest in society for, I think, for many years yet, because the transformations of genre it will go on more and more, you know.
It's inevitable.
We don't know. We don't know where we will get, but as long as we have the opportunity to talk about that and not hide, you know, that's very important. You know, that's very important.
But I think it's.
I have, for example, a patient that she's 40 years old, and she is homosexual for many years already. She knew she was homosexual. She has a female partner, etc., etc. But she cannot reveal to anybody that. So, with 40 years old, imagine the amount of tension and suffering and that is in there, you know. So she's getting better and better now, but her history.
And then a country like Brazil, these old value systems are stronger than in a city like Berlin.
Yes.
You know, homosexual people there is an atmosphere of much more tolerance and openness.
Well, this I don't know, but maybe.
Okay.
No, I just don't know.
I don't know Brazil so
because well. If you say Berlin is more tolerant.
Yes.
It might be, but there are cities in Brazil that are very tolerant.
I can't say. You are the expert.
For example, not expert, but I know, for example, the gay community in Rio is very powerful, very strong, and very open, and the gay community in São Paulo is very open too. So they have strong participation in culture, in life, etc. So, but Berlin is Berlin. So this is something maybe we can talk next time about. Difference in towns.
So,
so in the psychotherapy we find this kind of themes, huh?
And maybe one more thing, as you asked me, what's important for me in the body psychotherapy. Just one more thing which comes to me that is beyond the psychological themes. This is more about efficiency and way of working of our approach.
Yes.
After so many years and decades, I'm involved in this, and sure, the human stories are similar at a
Yes.
certain level, you
Yes.
know, where everybody is struggling for, and
Yes.
if you have seen so many patients, what I really love and keeps my passion alive for body psychotherapy is when we work, what I call in my very personal language, to work underneath the surface,
Yes.
underneath what's on top of the mind.
Yes.
So maybe here's a problem, or there's a real knot, and we don't get further with talking about it, and say, we leave it for a while at the side, and maybe you want to move a little around in the room. Maybe
Yeah.
you want to lay down and breathe a little.
Yeah.
So the changes which can happen by changing the level, going into the body, giving some space for some spontaneous
Yeah.
movement, feelings, explorations, whatever, and how in a little while it changes everything. You know, the perception, the thoughts, the mood.
Yeah. Yeah. I understand. Yes.
Mhm.
It's true.
Yeah.
So
And-
yes, when we have this eye on the sub, or
yeah,
it's
the
behind.
underneath
What's
working.
behind? Yes,
Yeah, the underneath. And
Underneath.
from there, for me, it's always that makes me humble towards the life force.
Yeah.
You know, to approach it with I don't know,
Yes.
and
Yes.
I'm allowed to not to know.
Yes.
You know, and
Yeah.
then sometimes I see a client and my mind with all my experience, like, oh, I think this will be the way about. But when I go totally open in the process, so often it's a total
Different,
surprise.
different perception.
Oh,
Yes.
what comes
yes,
out.
Yes. Yes. Yes.
And this I love.
I think our work is very much into the unknown,
Yeah.
and
Uh-huh.
as long as we are into the unknown, as more I think the psychotherapy
Mhm.
goes better. Yes.
Mhm.
Okay, Bettina.
Okay.
Thank you very much. Very nice.
Good.
Thanks. Thanks a
Yeah,
lot.
thank
Okay.
you.
Okay.
I think it's a great idea
I
what
think
you're
it was
doing
good.
there. Yeah.
So what I'm going to do is
Yeah.
what I'm going to do is
What's with your back?
my back is terrible.
Okay.
I will